And a very warm welcome to all you fantastic occupational therapists out there. Working in pediatrics is rewarding. Working in pediatrics is challenging. Working in pediatrics is joyful. Every single day, you can make a profound difference in the lives of children and their families. You are the champions of play architects of independence, supportive guides who help little ones navigate their world with confidence. Your role is not just about therapy. It's about unlocking potential, celebrating small victories, and fostering belonging and capability. It's a special calling, and your dedication makes the magic happen. This piece is a supportive companion for you, whether you're just starting your pediatric journey or you're a seasoned professional seeking a fresh perspective. We'll explore 4 common conditions: cerebral palsy, Down syndrome, autism spectrum disorder, attention deficit/hyperactivity disorder. Our goal is to demystify them in simple terms. We'll look at what they are, how they show up in daily life, and specific OT ways to help children thrive. Think of this as a friendly chat over a cup of tea. Let's begin with cerebral palsy, often shortened to CP. In simple terms, cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. It's the most common motor disability in childhood. The condition is caused by abnormal brain development or damage to the developing brain that affects a child's ability to control their muscles. This can happen before, during, shortly after birth. It's important to remember that CP is not progressive. The brain injury doesn't get worse over time. However, the symptoms and challenges related to movement can change as the child grows and develops. When you meet a child with CP, you might notice a few key things. Their muscle tone could be different. It might be very stiff, which we call spasticity, or very floppy, known as hypotonia. This can affect one limb, one side of the body, or all 4 limbs. Because of this, they may have difficulty with motor skills. For example, a young child might struggle with rolling over, sitting up without support, or crawling. An older child might find it challenging to walk, hold a pencil to write their name, or use scissors to cut along a line. These difficulties with motor control are the primary challenges that CP presents in a child's everyday life. So, where does an occupational therapist come in? Your role is absolutely vital in helping a child with CP gain as much independence as possible in their daily activities or occupations. You are the expert in adapting tasks and environments to suit the child's abilities. Next, let's talk about Down syndrome. This is a genetic condition that a person is born with. It occurs when an individual has a full extra copy of chromosome 21, or a partial extra copy of chromosome 21. This additional genetic material alters the course of development and causes the characteristics associated with Down syndrome. It's one of the most common chromosomal conditions. People with Down syndrome have a wide range of abilities. Each person is a unique individual with their own strengths, talents, personality. It is not an illness or a disease, and it cannot be cured. Children with Down syndrome often share some common physical traits, such as a flatter facial profile and upward slanting eyes. They also commonly have low muscle tone, hypotonia. This can make motor development a bit slower. A baby might take longer to learn to hold their head up, sit, or walk. Hypotonia can also affect fine motor skills, making tasks like fastening buttons, zipping a coat, or holding a crayon more difficult. Some children may also have speech and language delays, making communication harder and sometimes leading to frustration. Your role as an OT is to be a champion for the child's development. Work closely with the child and their family to promote independence. This includes self-care skills, feeding themselves, dressing, toileting. Support their play skills. Play is how children learn. Focus on developing fine motor skills and gross motor skills for school activities, handwriting. Now, let's explore Autism Spectrum Disorder, or ASD. Autism is a developmental condition that affects how a person communicates, interacts with others, and experiences the world around them. The word spectrum is really important because it highlights that every autistic person is different, with a unique set of strengths and challenges. There's a saying, if you've met one person with autism, you've met one person with autism. It's not a linear scale from mild to severe. It's a constellation of different traits. Some autistic individuals may be nonverbal and require significant support, while others may have exceptional skills in areas like math, music, art. The key areas of challenge often fall into two main categories. First, social communication and interaction. An autistic child might find it difficult to make eye contact, understand social cues like facial expressions or tone of voice, or engage in back-and-forth conversation. Second, restricted, repetitive patterns of behavior, interests, or activities. This can look like flapping hands, repeating certain words or phrases, intense interests, like trains or dinosaurs, or needing to follow a very strict routine. Many autistic children also have sensory sensitivities. They may be over or undersensitive to sounds, lights, textures, smells. As an OT, you play a crucial role in helping autistic children navigate an overwhelming world. Your focus is helping them develop skills to participate in meaningful daily activities. A big part of your work is sensory processing. Let's turn our attention to attention deficit/hyperactivity disorder, or ADHD. This is one of the most common neurodevelopmental disorders of childhood. Children with ADHD have differences in brain development and brain activity that affect attention, the ability to sit still, and self-control. It's important to understand that a child with ADHD isn't being naughty or lazy when they can't focus. Their brain is simply wired differently. There are three main types of ADHD: predominantly inattentive, predominantly hyperactive impulsive, a combination of both. It can persist into adulthood and impact school, home, social life. The signs are varied: inattentive type, daydreamer, trouble with details, difficulty following instructions, disorganized, frequently loses homework or toys. Hyperactive impulsive type, always on the go, fidgets and squirms, runs when inappropriate, talks excessively, struggles to wait their turn. Combined type, shows both sets of symptoms. These challenges make structured classrooms hard to navigate. As an OT, your goal is to help children build skills and strategies to manage symptoms and succeed. Focus, executive functioning. Skills, plan, organize. While each condition we've discussed is unique, there are some wonderful, overarching strategies in the OT toolbox that can be adapted to support children across the board. One of the most powerful tools is the Just Right challenge. It's about finding the sweet spot. Not so easy that the child gets bored, and not so hard that they become frustrated and give up. Scaffolding the activity builds skills and confidence. Another universally helpful approach is to make everything play-based. Play is the natural language of childhood. When therapy feels like play, children are more motivated and engaged. Need to work on fine motor skills? Let's have a tea party and practice pouring water. Great for wrist stability. Need to work on social skills? Build a giant fort together. Sensory regulation strategies are fundamental to pediatric OT. Creating a sensory-friendly environment can make a huge difference. Proactively incorporate sensory activities like swinging. Finally, the power of visual supports cannot be overstated. Our brains process images faster than words. Visuals are a lifeline for kids who struggle with language, attention, or sequencing. Use a simple first-then board. First work, then iPad. As we come to the end of our discussion, I hope you feel more equipped and inspired in your incredible role as a pediatric occupational therapist. But what's most important to remember is the person at the heart of the diagnosis and boundless potential. You are not just treating a condition, you are nurturing a human being. Never underestimate the ripple effect of your work. You are helping them climb their own personal mountains, and the view from the top for both you and the child is absolutely breathtaking.